The International College of Dentists is pleased to bring you this video on antibiotic resistance in support of our commitment to the United States Centers for Disease Control and Prevention. The ICD has an established partnership with CDC's Antibiotics Awareness Program, which involves disseminating information on antibiotic resistance and appropriate use in dentistry and medicine to ICD fellows worldwide. Antibiotic resistance is a worldwide problem that is being addressed by world leaders as one of the most critical issues facing peoples in all global communities. The ICD, in conjunction with the Rhode Island Dental Association, is offering 1 hour of ADA CERP continuing education credit for those who view the video and complete the knowledge test. The video presentation is offered at no cost to all ICD fellows, dental staff, and the general public, as a service to the dental profession. ICD fellow Dr. John Tollner, the chairman of the ICD Antibiotic Awareness Program, will be presenting the important information in this video. We would appreciate your comments and feedback on the video and knowledge test. Thanks for joining us today.
Greetings. My name is John Tollner, and I've been a fellow of the International College of Dentists now for over 21 years as of last month. I feel honored and privileged to be here today to discuss a critical global issue with you, antibiotic resistance. So how did I get here? Following graduation from the University of Maryland, Baltimore College of Dental Surgery, I went into the Army for 3 years, did a general practice residency, and came out and joined the Department of Veterans Affairs in Washington, D.C. is where it's based, and became a dentist with the VA medical system. As I got more into the system and back to Washington, D.C., I was asked to be the consultant for dental infection control to the Office of Dentistry in Washington. It was interesting that I didn't realize at the time what I primarily taught was standard precautions, but the standard precautions that I taught and universal precautions for bloodborne pathogens really kind of fits into what we're going to talk about today, because if you can prevent infections to begin with, you don't have to use antibiotics. Right now, I'd like to introduce a short video clip, which I think will give you a different perspective on how important the antibiotic resistance issue is in many people's lives.
We got involved in patient safety and in particular in raising awareness of Clostridium difficile infections following the death of my mother, Peggy, from a C. diff infection in April of 2010. Before she got sick, my mother was a kindergarten teacher in Brooklyn Public Schools, and she was probably the best person that I've ever known. She was generous, she was warm, she loved children. We grew up fairly poor. My mother was a single mom. She put herself through college and became a kindergarten teacher, and she put me through college, and she raised us, despite our meager circumstances, to believe that we could do and be anything. When my mother died from a disease that we'd never heard of, we were determined A, to understand it, and B, to combat it, to spare other families the loss that we had suffered. Antibiotics are wonder drugs. They have saved tens of millions of lives since their invention, but they are not without risks. And I think that the public needs to better understand that when you take an antibiotic, very often that is life-saving, but at the same time, if it's unnecessary or unwarranted, then it can also be exposing you to risks that are unnecessary. My mother was determined to have an impact on the future. She believed very strongly that knowledge was power, and that being aware of things and being educated was really key to your success in life and to your ability to navigate this complicated world that we live in.
I hope the video you just saw impressed you as much as it impressed me when I first saw it. And it just shows how this problem of antibiotic resistance can affect people and families by having dire consequences and adverse events, not just to mention the possibility of reactions to the antibiotics, and we'll be talking about that, but also this situation ended up with a death. So it's very serious, and we'll be talking about that during the course of the video. Let's go back to the presentation now. The International College of Dentists has a website, as you're well aware, and on that website, to find the antibiotic resistance portion of it, be aware, antibiotics aware, this slide depicts how to get to it. Go to the project section, look under dental safety program, and you'll see Get Smart About Antibiotics. And if you go there, you'll see the following. This is at the beginning, and it talks about something I want to read to you directly because it's important. Antibiotic resistance is a critical issue to public health systems worldwide. Because of it, infections that were once treated easily with antibiotics are becoming more dangerous, causing treatment failures, prolonged suffering, and even death. The International College of Dentists formed a partnership with the Centers for Disease Control and Prevention, Get Smart, Know When Antibiotics Work program. The mission of this partnership is to disseminate critical information on antibiotic resistance and appropriate antibiotic use to ICD fellows worldwide. As you go down and scroll down in the website on antibiotic resistance, you'll find this, which is articles and media resources that we try to update routinely. But you can see on the left, there are numerous articles that will help you get direct access if you just want to read a short article. If you need media resources, there are media resources, including the new CDC training video you see at the top, which, again, you'll be getting handouts from as part of this presentation. At the bottom, get your antibiotic awareness graphics here. If you wanted to have something to contribute to spreading the word, we'd be happy to help you. Viruses or bacteria, what's got you sick? This is important because antibiotics only work for bacteria. They do not work for viruses. For instance, strep throat is a bacteria and antibiotics would work. Whooping cough is a bacteria. Antibiotics would work. UTIs are bacterial and antibiotics would work. Sinus infection, antibiotics only may work and they may not work. So you need to have that identified clearly in the diagnosis and possibly cultured. Middle ear infections, again, maybe antibiotics would work. Bronchitis, no. That is considered, or chest cold, that is considered a viral infection and they wouldn't work except studies show, the star, the asterisk, studies show that otherwise healthy children and adults, antibiotics for bronchitis won't help you feel better. Common cold and runny nose is viral and they won't work. Sore throat, except strep, no, they won't work. And finally, the flu, which is viral, and again, the antibiotics don't work. I want to go back and look at the history of antibiotic resistance briefly. It's interesting, when penicillin was first discovered in 1928 by Alexander Fleming, it wasn't really distributed to the general public until 1945, but already in 1940, as you see here, we had penicillin-resistant staphylococcus. Penicillin was used in World War II for the Allies and was considered a wonder drug for how many people it saved. Again, in 1945, Alexander Fleming won the Nobel Prize for his discovery of penicillin. But he also, during his acceptance speech, warned about the possibility and what he had already seen is the possibility and the likelihood of resistance if this drug was used improperly and the proper doses weren't written for. So this was already looked at as a potential issue by him, Dr. Fleming, when he got his Nobel Prize. He brought that to the attention of people. If you go down this chart a little bit, on the right-hand side, it tells you when different drugs were introduced. Tetracycline was introduced in 1950. Tetracycline-resistant Shigella happened in 1959. Erythromycin was introduced in 1953. And we see in 1968, erythromycin-resistant Streptococcus. Methicillin, a drug you're very familiar with, was introduced in 1960. And then in 1962, 2 years later, you see methicillin-resistant Staphylococcus, or what we know as MRSA. A woman died from a superbug resistant to all available antibiotics in the US. This was a news article, and this happened to be in CBS News. This is what your patients are seeing. This is a CDC slide that depicts the national summary of data for antibiotic resistance, and it's really important to understand the depth of this. Antibiotic resistance causes over 2 million illnesses every year and 23,000 deaths. And this is an estimate, but it's a very close estimate, the best they can do. Estimated number of illnesses and deaths due to C. difficile, Clostridium difficile, and we're going to be talking about this later in the presentation, 250,000 illnesses and 14,000 deaths in a year. And again, this slide's a couple years old, but it takes CDC a while to get these statistics together. Another CDC slide, a growing crisis worldwide. This is not local to any country. It's a worldwide problem. Antibiotic resistance global threat. And that's why I'd like to stress this with the International College of Dentists. In my contact with the CDC folks and direct contact, they said we have actually filled a gap for them because many groups are centered primarily in the United States, but we are one group that's international, and we hope to reach as many people with this educational information as possible. So we'd really like you to take it to heart and spread the word in your country to the best of your ability. If you need speakers, we can work on supplying that. And even in the United States, we can provide speakers if needed. But the biggest thing is understanding this is a worldwide problem, not just the United States, not just Europe. The impact is unknown because there's no way we can really track the number of antibiotic resistance globally right now. Without urgent action, many modern medicines would become obsolete, turning even common infections into deadly threats. They refer to this as the post-antibiotic era, if it does ever occurred. And what that means, again, is a simple infection, something like you cut your hand, you get an infection, and now we have no antibiotics that can treat it because of a superbug or an antibiotic-resistant organism. And I've seen some of this in our area in Virginia. There are resistant bugs such as Vibrio in the water in some areas, such as the Chesapeake Bay. And when people get cuts, they can get very serious infections very rapidly. An estimate by the United Kingdom, and this was actually done by the top economist for the United Kingdom, estimated that he was requesting $40 billion to tackle the antibiotic resistant issue. So again, globally, this is a huge problem and very expensive to go at. But if they don't do something, they're going to have a bigger problem every year. And as we go on, this is the G20 met in July of 2017 in Hamburg, Germany, shaping an interconnected world. And I'm not going to read the preamble to you, but what I did is go down a few notches and take out what they said about combating antibiotic resistance, or AMR, antimicrobial resistance. An antimicrobial resistance represents a growing threat to public health and economic growth. To tackle this spread of AMR in humans, animals, and the environment, we aim to have implementation of our national action plans based on One Health approach, well under the way by the end of 2018, which is this year. We will promote the prudent use of antibiotics, and that is the biggest thing. So you see, with this G20 declaration in 2017, they had hoped to have these things going and in place, and you'll see where some of them are. This is the World Health Organization. What did they say about it? This is their national action plan. They produced in 2015. In May 2015, the 68th World Health Assembly adopted the Global Action Plan on Antimicrobial Resistance. The goal of the Global Action Plan is to ensure, for as long as possible, continuity of successful treatment and prevention of infectious diseases with effective and safe medicines that are quality assured, used in a responsible way, and accessible to all who need them. What about the UN? The UN General Assembly. In 2016, the UN General Assembly met, and among one of their top priorities was antimicrobial resistance. And this is the world leaders. They signaled an unprecedented level of attention to curb the spread of infections that are resistant to antimicrobial medicines. Antimicrobial being against microbes. For the first time, heads of states committed to taking a broad, coordinated approach to address the root cause of AMR, antimicrobial resistance, across multiple sectors, especially human health, animal health, and agriculture. This is only the fourth time that a health issue has been taken up by the UN General Assembly. And again, these are the top leaders in the world. The others were HIV and Ebola, which you remember how big they were. So this is a big deal. What about the European Antibiotic Awareness Day? They have an awareness day. This is part of the ECDC. It can be under that, and that is the CDC in Europe. And they have one antibiotic awareness day, whereas we have an antibiotic awareness week, and it's going to vary throughout the world, but they try to get as many countries involved in this as they can. And this one happens to talk about communicating to professionals in hospitals and long-term care facilities, which is, again, hospitals and long-term care facilities are a big issue, particularly when it comes to something like Clostridium difficile. How about the Transatlantic Cooperation, or TAPFAR? TAPFAR is a cooperation between Canada, the European Union, and the United States and Norway, and it's an effort to keep area focused to reduce the threat of antibiotic resistance. So now we see another group getting together to try to fight this together in a consolidated way. We are, again, getting ready to celebrate an observance that happens annually in the United States. The CDC puts out Get Smart programs and observances, and this one is Antibiotic Awareness Week. Keep your eyes and ears open for this when you get emails or when you go on CDC, because it's an annual event. It provides very good training materials. And by the way, everything that CDC has online is free to you as long as you don't alter it. You can use it for educational purposes, and there's no charge. It's all free. And also you can keep in mind the World Health Organization is a good resource. Examples of disease-causing bacteria you see on the next slide here are strep throat, which is a bacteria and will respond to antibiotics. Food poisoning with bacteria with salmonella is, again, being a bacteria, will respond to antibiotics. But the viruses like cold virus and flu do not respond to antibiotics. Athlete's foot respond to antifungals, and malaria is a parasite, which is a microbe, but it responds to antiparasitic medications. So you need to keep these things in mind. How does antibiotic resistance happen? Lots of germs and a few resistant drugs in the mix. Then in the second one, antibiotic kills bacteria causing illness as well as good bacteria protecting the body from infection. So when you give an antibiotic, in every case, you're very susceptible to having greater mutations and therefore greater resistance form every time an antibiotic is used, even if it's used appropriately. The drug-resistant bacteria are now allowed to grow and take over. Some of the bacteria give their drug resistance to the other bacteria, causing even more problems. So it can be bacterial, and you're going to see other ways in the next slide how this can be transmitted. But it's extremely important to realize that drug resistance happens rather quickly. So we'll go to the next slide, examples of how antibiotic resistance spread. And if you look to the left here, you see antibiotics given to farm animals, such as cows and chickens and pigs, in great doses to promote growth, to promote health. This is a huge problem because drug resistance can multiply within these animals, and they can be spread to humans through improper food handling, improper cooking. It can be spread via fertilizer or water contaminating animal feces, and drug-resistant bacteria is used on the crops, not to mention getting into the water system. Drug-resistant bacteria in animal feces can remain on the crops and be eaten. These bacteria can remain in the human gut for a period of time. So that's a significant way it can be transmitted. And again, you have George, who's the man we're looking at the top. If you go to the right, George gets antibiotics and develops a resistant bacteria in his gut, which was what we saw we see in different cases many times. And you also see adverse effects like the Peggy Lillis story. So when that happens, you have antibiotic resistance in the human's gut, and it can go two different ways. He can stay at home and in the general community spread resistant bacteria to others by not improper hand washing and other different ways, but hand washing is a big deal for this. Or George gets care at a hospital or nursing home or an inpatient facility. And a couple things can happen here. Resistant bacteria can be spread to other patients from surfaces within the healthcare facility. And that, again, has to do with improper hand washing. And we're going to talk about hand washing. Resistant germs can spread directly to other patients or indirectly on unclean hands of healthcare professionals. And that's a big thing in the hospitals where they're working on trying to make sure, as you see, that there are many opportunities for healthcare professionals to keep their hands clean. One thing I need to mention now, and I'll probably mention it later, is that alcohol gels are good in many cases where there's not visible bioburden or dirt. They work effectively against most bacteria, but Clostridium difficile is actually a spore, and alcohol gels are ineffective against that organism because it's a spore and it's very resistant. You can do the best you can. If you don't have hand washing station, obviously you try to clean your hands and then use the gel to the best of your ability. But keep in mind, it does not affect C. difficile spores, whereas hand washing does with soap and water, good old hand washing. Patients go home and the cycle continues. Patients go home after being infected in a healthcare facility, and we go back to George standing with the crowd. So again, you have the animal source, you have the hospital source, you have the community source, where all this can be blended in and be a source of antibiotic resistance transmission. Here we have a slide depicting some of the issues about infection information for patients. You take only the antibiotics that are prescribed by a doctor, or in our case, the dentist. Antibiotics can be life-saving, and that's very important to keep in mind throughout this. However, when a person takes antibiotics, and again, kills good germs as well as bad germs, they're destroyed in many cases for several months. And during this time, patients can get sick from C. difficile picked up from the contaminated surfaces or spread from healthcare providers' hands. And we just mentioned that in the last slide. So that's a bad actor, as you saw already in the video. The most at-risk people, especially older adults who take antibiotics and also get medical care, this is a major issue, and it's particularly in the hospital environment, but it's also in the community and in healthcare facilities. I don't really want to spend my time talking to you all about hand washing because most dentists have this down to a fine art. I hope we set the bar on hand washing. But one study I read not too long ago said basically when interviewed, about 1/3 of the people they interviewed admitted to not washing their hands after using the restroom. Now, that's anecdotal, but this hand hygiene and other infection prevention measures are important for every patient. So, as I said, C. difficile does not respond to the hand gel. It will not kill the spore. Whenever possible, use soap and water, good old soap and water. And if you don't have that option, do the best you can to clean your hands. and get to a facility, a place where you can wash your hands. But it works for most of the organisms we're dealing with, just plain old hand washing with soap and water. And again, as dentists, I'm sure you, like myself, end up going home many times at night and wonder why you're washing your hands. You're so used to doing it. This is the single greatest thing, particularly in hospitals, to prevent the spread of infections is hand washing. Simple hand washing, and not just a rinse with water, but soap and water, 20 seconds, wash, rinse, sing happy birthday, do whatever you want, but don't just sprinkle a little water on your hands and think it's going to work, because it doesn't work that well. This is a study that I wanted to point out about resistant infections rising with longer hospital stays for U.S. children. And what they're talking about is because of antibiotic resistance threatens our ability to treat our children's infections. In other words, they've already become resistant. We end up seeing longer hospital stays. Efforts to control this trend are urgently needed from all of us because, as you know, hospital stays are expensive, such as using antibiotics only when necessary and eliminating agricultural antibiotics from healthy animals. I've actually gone to buying antibiotic-free poultry when I can. It's sometimes very high, very expensive. If you can get antibiotic-free poultry, beef, whatever you're eating, it's definitely better than having ones that have the potential of having developed antibiotic resistance because of excess antibiotics. This is primarily for dentists, and it's primarily for you and your patients, but also think of your family. And this is an important slide. And I will mention again, CDC information is free. You don't have to pay for it. And you can go on a page like this, and they have pages for patients, protecting yourself and your family. And it puts it very much in the layman's terms. And the more we can get this word out to people and the importance of minimizing the potential for antibiotic resistance, the more that we're going to benefit as a society. And this isn't just one group benefiting. This happens when we're an air travel group right now. You go to another country, you pick up something, you bring it back. You go from the United States with something, take it to another country. There are all kinds of problems. However, if you do the basic ways and basic things to help your family, and such as healthy habits, staying safe when you're sick, staying safe while in a hospital, and you can question hospital workers if you don't see them washing their hands. That's your right. And staying safe while traveling, which I just talked a little bit about. Simple thing. Again, we're back to clean hands. And when you're traveling, that becomes a problem sometimes, but try to make it work. Get the soap and water when you can, whenever you can. If you can't get to that, use alcohol gel. I travel with it. Stay up to date with your vaccines. Again, prevent infections. Don't get something that you don't need. If you're vaccinated against some of these things, be it the flu, some of the other vaccine-protected diseases, you'll do yourself a great service by not having to get either antibiotics. Now, antibiotics doesn't work for the flu. I've already mentioned that. But other things that are bacterial. Prevent the spread of foodborne infections. And we talked about handling food, if it's properly cooked, and how it's managed both in the kitchen but also at the slaughtering plants. Keep your water safe. Again, safe water, clean water, and again, without bacteria, such as the water that's used sometimes in the fields, and we talked about with agriculture, and it's improperly washed. Prevent the spread of sexually transmitted diseases. That's another big one in this country. It doesn't really apply to what we're talking about, but gonorrhea the numbers are going up and up, and that's, again, due to bacterial resistance. Approximately, when you talk about improving the use of antibiotics to combat antibiotic resistance, this slide depicts that about 30% is the estimate, general going estimate, of antibiotics that are written are purely not needed. And of the 70% that are written and may be needed, a good portion of those aren't specific for the organism and may not be beneficial to the patient at all. So of that 70%, you need to knock that down a little bit because it's an improper antibiotic. It may be a narrow spectrum antibiotic that's not going to target that particular organism. So this is very significant, especially when you consider that dentists write approximately 10% of the outpatient prescriptions in the United States. Reasons antibiotic prescribing guidelines are not followed. Belief that non-recommended agents may be more likely to cure an infection. So a patient comes in and may want an antibiotic, and they're certain it's going to help their cold or something, and you have to be an educator and explain to them that it won't, and it could be very harmful because of allergic reactions or adverse events. Mother brings child into the clinic and demands patient satisfaction because she's paid the copay, maybe, and she has the child at the doctor, and the doctor said, well, your child has an ear infection, but he doesn't really need antibiotics. And the mother says, well, I've paid for this and I really want to get antibiotics. You have to educate them and say, all that can do is cause your child harm, and tell them why. And be sure you have information to back that up, and you can show them. Fear of infection complications and related negative consequences. Guidelines may not be followed because some doctor may be a fear of unintended consequences or complications from that and may not want to give the antibiotic, or somebody gets the antibiotic and decides not to take it. You need to educate your patients, and we're going to talk about this on how to take antibiotics properly as prescribed, and not just part of the antibiotics and give the rest to a friend or use for a different time. How many times have you heard someone say, well, I had a cold the other day and I took 2 penicillin that I had left over from another appointment, and boy, do I feel better today. That's not the way it's intended. It's not used for a cold, and you should not have taken antibiotics, and it can harm you. Doctors prescribe more antibiotics when expectations are high, and this was a study that was published in a journal for the American Psychological Association. And basically what it boils down to is physicians are more likely to prescribe antibiotics when they believe there is a high expectation of it from their patients, even if they think the probability of bacterial infection is low and antibiotics would not be effective. This is not good. Again, you need to educate your patients. You say, if I give you the antibiotic, you could very well have an allergic reaction to it. You could very well have an adverse reaction to it, and this can only hurt you. You really don't need an antibiotic. And again, if you can show them something in writing, that would be a good thing to support your position. A couple of situations, and again, this was in Discover magazine as one of the top articles, top 100 articles a couple of years ago. But these are things that are being done. Don't go away totally down about the concept that this can't be hopefully cured, or at least decrease the antibiotic resistance. But think twice before blowing your nose. Bacteria living in there could save your life someday. And this was reported in the journal Nature. Researchers found a new antibiotic produced by nose-dwelling bacteria that kill drug-resistant superbugs, including methicillin-resistant Staph aureus. A new antibiotic packs a punch against bacterial resistance, and this is Scripps Research Institute in La Jolla, California. Scientists at the Scripps Research Institute have given a new superpowers to the life antibiotic called vancomycin, which you're familiar with, an advance that could eliminate the threat of antibiotic-resistant infections for years to come. The researchers, led by Dale Bogert, co-chair of TSRI's Department of Chemistry, discovered a way to structurally modify vancomycin to make an already powerful version of the antibiotic even more potent. Doctors could use this modified form of vancomycin without fear of resistance emerging. So things are being done. It's just a question, a lot of them are still in the research phases, and this is the kind of thing we need to have funding for throughout the world. This next slide depicts, as it says, 7 ways dentists can act against antibiotic resistance. And now we're getting specifically more into the dental aspect of this thing. Number 1, make an accurate diagnosis. Try to pin the organism to the best of your ability, and that may involve culturing, but use a narrow spectrum whenever possible, as much as possible over broad spectrum, and that will minimize the chance of antibiotic resistance. Number 2, when prescribing an antibiotic, choose the right drug for the right dose and duration. And it's very important to make sure you educate your patients to take the dose, take it for the full duration. Do not stop taking the drug, and if there's a reason they need to do that, they need to contact you. Number 3, use narrow spectrum antibiotics for simple infections and preserve broad spectrum drugs for more complex infections. And what this does is by getting a more narrow, you're more likely to hit the target and not have as many overgrowth mutant bacteria that can spread resistance. 4, avoid prescribing antibiotics in viral infections, and we've talked about that already. 5, for empiric treatment, revise the retreatment regimen based on the patient's progress, and the test results you receive back in cultures or whatever it may be. 6, know the side effects and drug interactions of the antibiotic before prescribing. And that way, if a patient has a problem, you can address those problems for them. Number 7, teach your patients about appropriate antibiotic use and emphasize the importance of taking the antibiotics exactly as directed, and we mentioned that earlier. The CDC provides for you, and I'm not going to read this whole thing off. We want to keep this within the hour, but the checklist for antibiotic prescribing in dentistry is very helpful. And first, there's pre-treatment, and you'll be getting handouts available at some point on the International College of Dentistry website about antibiotic awareness, and we'll talk about that in a moment. That will get specifically into pre-treatment needs and information you can show your patients if you need to. Prescribing, appropriate prescribing, and again, they have a number of things to check off to keep yourself where you're comfortable that you're doing the right thing for the patient. Patient education, again, educate your patients on how to take the antibiotic, how long to take it, and not to stop in the middle of the course. And staff education. By staff education, what they'd like you to do is keep the staff in tune with what you're doing and explain. They may help the patient in telling the patient to be sure to take the full dose in the proper manner. Antibiotic do's and don'ts. Again, I don't have to read all of this, but I'll read a few of them for you. This is, again, a CDC slide, or it's a poster in some cases, or it's online as an infographic for you. And do tell your dentist if you have any drug allergies or medical conditions. Do tell your dentist about medications, vitamins, or herbal supplements. Do ask how some oral infections can be treated without antibiotics. Do tell your dentist if you have side effects such as frequent diarrhea while taking it or shortly after stopping antibiotics. Do not skip doses of antibiotics, and this is a patient thing again, without consulting your dentist. Do not save unused antibiotics for future use or giving them to others. Do not take antibiotics not prescribed for you that are prescribed for others. That's a big mistake. Do not pressure your dentist into prescribing antibiotics. And again, as the dentist, you can do a good job of explaining to them why they don't need antibiotics if that's the case. And then they give you a reference point where you can click on. It's click and go at the bottom of this if you want more information on that. This is an article that came out in 2017 issue of the Journal of the American Dental Association about antibiotic prescribing by general dentists in the United States. Again, I'm not going to be getting into great detail on this, but antibiotic prescribing in the U.S. in 2013, that's how long it took them to go back and get this information. And Rebecca Roberts, I just want to mention, is my CDC contact that helps me a lot with the partnership we're doing and also getting me information. And I wish to acknowledge that. And she's the primary author, actually, on this article. So the abstract is dentists prescribe approximately 10% of outpatient antibiotics, which we mentioned earlier, but little is known about dentist antibiotic prescribing patterns. The authors conducted a study to characterize prescribing by dentists according to antibiotic agent and category of the agent, patient demographic characteristics, and the geographic region within the United States. Now, again, I'm sorry, these are mostly within the United States, but being that we're working with the CDC, that's where I'm getting a lot of information to provide to you today. And I'm going to skip down to the practical implications of this and the conclusions. The conclusions are dentists prescribe large quantities of antibiotics in outpatient settings, and there is considerable geographic variability, which is interesting. Additional study is needed to better understand the reasons for the variability and identify areas of possible intervention and improvement. So getting the information is not easy. Putting together information on this particular issue of prescribing patterns for dentists is hard to get, as it is with the medical community. And practical implications, continued efforts to continue antibiotic resistance will require all prescribers, including dentists, to examine prescribing behaviors and appropriateness and the effectiveness of guidelines to identify opportunities to optimize antibiotic use. That gets us in the ballgame. We need to look at it. We need to be involved as dentists. Another article that just came out last month, October 2018 issue of the JADA, the use and misuse of antibiotics. And again, I don't have time to get into great detail on this, but I think it's important that you get these articles and read through them because they have a lot of good information. Again, the background on this is to describe antibiotic prescribing behaviors in dentistry, again, similar to the previous article, including clinical and non-clinical indicators for their use, and the type of regimen and antibiotics prescribed, the factors influencing their prescription, and the authors have conducted a scoping review of this. The conclusions and practical implications here are that considering the seriousness of antibiotic resistance, the authors highlight trends in antibiotic prescribing practices, characterizing factors contributing to the use and misuse of antibiotics in dentistry, providing insight into the importance of antibiotic stewardship in the oral health setting, and encourage dentists to reflect on their antibiotic prescription practices. So we all need to look at what we're doing. And I will say right now, during the primary part of my career as a hospital dentist, treating many outpatients as well, I know there were times when I prescribed antibiotics. I didn't know it at the time, but I know it now, when they may not have been needed. You take care of an emergency or a patient on a Friday afternoon, and you don't want them to go through suffering, so you might prescribe a broad spectrum antibiotic to take care of that. That's not really a good thing when we just said it's better to try to hit a narrow spectrum antibiotic. So this can be any of us. It's not pointing fingers at anybody. It's saying, what can we do to improve where we are now? And I think that's the most important thing. I would have done things differently in some cases. This final slide is an important one to me and to you as a fellow in the International College of Dentists, and I wanted to reiterate it here. The ICD's mission is to make available information from the CDC and the World Health Organization and other resources to assist fellows globally in understanding the critical importance of antibiotic resistance, as well as the appropriate use and overprescribing issues facing the world today. Now, before I go today, I do want to mention that we are going to have some specific guidelines, both from the American Heart Association, the American Dental Association, and including the American Orthopedic Association on antibiotic prescription recommendations, and that will be coming in the form of a handout, but it has changed dramatically. It changed in 2007 regarding recommendations for heart premedication and why, and it changed fairly recently again for the orthopedics. And again, in many cases, there's a lot of questions that come up between orthopedists and dentists, patients and dentists, because they're used to taking these antibiotics before their treatment. They were told they needed to do this, and now we're telling them they may not. And as a matter of fact, they probably don't in many cases. And the antibiotics could actually be harmful to them. For instance, if a patient is allergic to amoxicillin and you're given an antibiotic for a heart condition, and you look at the other antibiotics that come up as alternatives to that patient, one of them is clindamycin. And we already saw a very terrible adverse event with the Peggy Lillis story, the other side of antibiotics when clindamycin was given. Yet we want to minimize that when it's not needed. So I wish to thank you for your time today, and hopefully stay antibiotics aware.